On today's video, we're going to cover my top 5 tips on how to return to running successfully following patellofemoral pain. Welcome back, Run Smarter scholars. Today we are discussing patellofemoral pain, in particular how to return to running successfully following this condition, and mainly described by pain around the outside of the borders of the kneecap or underneath the surface of the kneecap, and aggravated by things like squatting, lunges, moving up and down stairs, and of course running. Now, despite what you might hear or read, this particular condition isn't necessarily caused by ITB tightness or maltracking of the kneecap. Instead, it is an overload of the joint, because the patellofemoral joint, that kneecap joint, has a certain capacity, and if you exceed that capacity in your training, it's going to get sore or increase the likelihood of developing into an injury. So because this is an overload injury, treatment and return back to running should be managed very carefully, what we call load management. And it's very important that we consider this when returning to running. So keep this in mind as we go through our 5 top tips. Tip number 1 is to increase your running cadence, which is the amount of steps that you take per minute, and hopefully while traveling at the same speed. And this is because research has shown that if you increase your cadence by 10% while traveling at the same speed, you will reduce your stride length, so you'll reduce the distance between your steps. And there was a study done by Wilson and colleagues that conducted this study and depicted a graph that shows that if you reduce your step length, you significantly decrease the amount of load going through your patellofemoral joint. And if you're looking for ways to increase your cadence, if you're not too sure how to increase your cadence while traveling at the same speed, I have created another video that explains all that, and I'll leave it in the description. Now, the next 3 tips that I have for you comes from a paper by Patellofemoral and colleagues, and what they did was took 69 runners with patellofemoral pain that had to have patellofemoral pain for at least 3 months before being included in this trial. And they divided these 69 runners into 3 groups. One was the education group, received education only. The second received education and strengthening. The third received education and gait retraining, or trying to change how they're running. And all groups showed a significant improvement, and they all improved at the same rate. So this begs the question, how good was this education, or what did this education contain that was so effective? Well, the first is they were asked to increase their running frequency, which is our number 2 tip for today's video, which essentially means running at the same mileage, but just spreading it across more days. For example, instead of running 3 days a week for 30 minutes, you're spreading that 90 minutes across something like 5 days. Tip number 3 involves advice around pain levels, and was the next bit of education received in this Patellofemoral paper. And they mentioned that pain no more than 2 out of 10 during running, which means 0, 1, and 2 out of 10 pain during the run was acceptable, provided that pain needed to return back to pre-training levels within 60 minutes of the running session, and shouldn't exceed symptoms or exceed baseline symptoms the following morning. So you're paying attention to the pain levels within those 3 snapshots in time. In addition, I will add, your symptoms should be improving week by week. So as long as you're abiding to all of these pain rules, you should be training within acceptable guidelines. But the main aim here is that you don't necessarily need to aim for pain-free running every time. It just needs to be low levels of pain that quickly settles afterwards. Tip number 4 is to monitor and progress certain training parameters very, very carefully. The Patellofemoral paper instructed participants to decrease their running speed and avoid downhill and stair running. These sort of parameters should be decreased when the knee is quite irritated, but if symptoms start to improve, you can reintroduce these things. You can reintroduce hill work and speed, but these things need to be monitored and progressed really gradually. So we're looking at your overall weekly mileage, we're looking at your running speed, we're looking at your hill running, and you need to progress these sensibly and abide by the same pain levels that we discussed in tip number 3. And lastly, tip number 5 revolves around strength training or rehabilitation exercises to get you back to running more efficiently. So strength helps build up the capacity of the knee progressively alongside your building up of running endurance. And it involves taking your current capacity, what you can currently tolerate, and bridging the gap to your next running objective. So that might be increasing running speed, increasing weekly volumes, distance, those sorts of things. And we call this the rehab ladder. It's essentially progressing to the next rung by progressing your running dosages or progressing your strength rehab as symptoms allow. And if you'd like a bit more advice on the specific exercises for patellofemoral pain, I've created another video working up that rehab ladder, and I'll include that link in the description below. So there you have it, my top 5 tips. And I'll leave you with one little bonus tip before we go. And during your rehab, it's really important that we highlight any common myths surrounding this condition. Because if you abide or subscribe to some of these myths, it can pull you in the wrong direction for effective recovery. And for this reason, because there are a few myths out there, I have created another video on the 5 most common myths. So I'll leave that there for you to go check out. Before you check that out, if you've liked anything, hit the like button. If you haven't already, hit subscribe. And as always, if you have any questions around patellofemoral pain, you can leave that in the comments below.